Hey guys, this is FixerMed. Welcome back to my high-yield biochemistry review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 17 of my multi-part video series covering the entire discipline of biochemistry from start to finish in a comprehensive but high-yield manner. So without further ado, let's go ahead and get started on today's content. I'd like to start off today by talking about trinucleotide repeat disorders with you guys. And the first one we'll be talking about is Huntington's disease. The main genetics that underlie Huntington's disease are that it has a CAG codon repeat expansion on chromosome 4. It is inherited in an autosomal dominant fashion, and it encodes the Huntington protein. Note the different spelling. Sometimes they might get you with that on a multiple choice question. So Huntington versus Huntington protein. The onset of Huntington's disease mainly occurs with neurodegeneration with cognitive decline and chorioatosis, which typically starts in the 40s or 50s. And an important point to note, anticipation is the expansion of trinucleotide repeat length in successive generations, which leads to earlier and more severe disease onset. And I have a picture of a normal brain section and a brain affected with Huntington's disease to visually aid you guys. Moving on, I'd like to talk about Friedreich ataxia next. The genetics that underlie this trinucleotide repeat disorder involve a GAA repeat expansion on chromosome 9. It is inherited in an autosomal recessive manner, and this encodes the frataxin protein. The primary clinical features found in Friedreich ataxia are kyphoscoliosis, cardiomyopathy, pescevis, high arch feet, hammer toes, and early onset type 2 diabetes. And I have a good pictures at the bottom illustrating the pescevis and the kyphoscoliosis and cardiomyopathy on the bottom right. Moving on. Next, I'd like to talk about Fragile X syndrome. The main genetics that underlie this trinucleotide repeat disorder are a CGG repeat, and it is inherited in an X-linked dominant fashion. The main clinical presentation of Fragile X syndrome is a low IQ level, and it's the most common hereditary cause after Down syndrome for this disease. Macroorchidism and long, narrow jaw face with averted ears. And the associated gene with this trinucleotide repeat disorder is the FMR1 gene. And I have a illustration here that showcases a lot of the clinical features found in a typical patient suffering from Fragile X syndrome. Moving on, I'd like to next talk about myotonic dystrophy. The main genetics that underlie myotonic dystrophy are a CTG repeat expansion on chromosome 19. It is inherited in an autosomal dominant fashion, and it encodes the myotonic dystrophy protein kinase. The primary clinical manifestation found for myotonic dystrophy is the reduced ability to relax muscles, aka the difficulty letting go of a doorknob, golf club, or handshake, etc. And I have a picture here of a patient suffering from myotonic dystrophy. So hopefully that helps you for your notes. As you can see, they also have gynecomastia here as one of the symptoms, cataracts, etc. So all high yield, very important to know. Moving on. Next, we'll be talking about some questions. So now we have a 44-year-old male who presents with cognitive decline over the past 6 months and abnormal movements of his limbs. His father had a similar presentation in his 50s. What mechanism best explains this patient's presentation? All right, I think I gave you guys enough time. Let's go ahead and move on. If you need more time, please feel free to pause the video. The patient's presentation is consistent with Huntington's disease, autosomal dominant chromosome 4, characterized by 40 plus trinucleotide repeats, TNR, of the CAG codon. The correct answer is anticipation. Anticipation is a high yield term associated with trinucleotide repeat disorder, signifying a pattern where the disease presents increasingly more severe and earlier with each successive generation. This phenomenon is attributed to the expansion of the number of trinucleotide repeats with each generation. Therefore, the correct answer is D, anticipation. Let's go ahead and see why the other answer choices are incorrect. So X-linked dominance, Huntington's disease is autosomal dominant, not X-linked. Polygenic inheritance, Huntington's disease is primarily associated with a single gene, not multiple genes. Imprinting involves the expression of a gene based on its parental origin and is not the primary mechanism in Huntington's disease. Autosomal recessive inheritance, Huntington's disease follows an autosomal dominant pattern, not an autosomal recessive pattern. Let's go ahead and move on to the next question. We have a 25-year-old woman who presents with progressive cognitive decline and psychiatric symptoms. Her family history reveals that her mother experienced similar symptoms in her 50s. Genetic testing shows an abnormal expansion of CGG trinucleotide repeats on the X chromosome. What mechanism best explains this patient's presentation? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The patient's symptoms and genetic testing results are indicative of Fragile X syndrome caused by an abnormal expansion of CGG trinucleotide repeats on the X chromosome. Fragile X syndrome follows an X-linked dominant pattern where a single copy of the mutated gene on the X chromosome is sufficient to cause the disorder. Therefore, the correct answer is A, X-linked dominance. Let's go ahead and see why the other answer choices are incorrect. Polygenic inheritance. Fragile X syndrome is primarily associated with a single gene on the X chromosome, not multiple genes. Imprinting. Fragile X syndrome does not involve imprinting, which is the expression of a gene based on its parental origin. Trinucleotide repeat stability. While trinucleotide repeat stability is relevant to the disorder, it is not the primary mechanism responsible for Fragile X syndrome. Autosomal recessive inheritance. Fragile X syndrome follows an X-linked dominant pattern, not an autosomal recessive pattern. Let's go ahead and move on to the next question. A 30-year-old man presents with episodes of sudden involuntary muscle contractions and spasms, particularly in his face. These episodes worsen with stress or excitement. His father had a similar condition that started in his late 40s. Genetic testing reveals an abnormal expansion of CTG trinucleotide repeats on chromosome 18. What mechanism best explains this patient's presentation? All right, I think I gave you guys enough time here. Let's go ahead and move on. The patient's symptoms and genetic testing results suggest myotonic dystrophy, autosomal dominant chromosome 18, caused by an abnormal expansion of CTG trinucleotide repeats. In myotonic dystrophy, the instability of trinucleotide repeats play a crucial role in the pathogenesis of the disorder. Therefore, the correct answer is D, trinucleotide repeat instability. Let's go ahead and move on and see why the other answer choices are incorrect. Autosomal recessive inheritance. Myotonic dystrophy follows an autosomal dominant pattern, not autosomal recessive. Polygenic inheritance. Myotonic dystrophy is associated with a single gene, not multiple genes. Genomic imprinting. Genomic imprinting is not the primary mechanism in myotonic dystrophy. It involves the expression of a gene based on its parental origin. Autosomal dominant inheritance. While myotonic dystrophy is inherited in an autosomal dominant manner, the specific mechanism at play in this disorder is trinucleotide repeat instability rather than simple autosomal dominance. So that will do it all for this video, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, this is FixerMed signing off. Have a good day, everyone, and good luck studying. Goodbye.